Great. So, hello, everyone. Welcome. Liat here from Hyro. I'm thrilled to be your session host. Feel free to type your questions in the chat, which I'll be moderating. Thanks for joining us for Tales from the Trenches, Lessons Learned from the Frontlines of Healthcare Transformation. I love that title, by the way. This is led by Reid Stephan, a very good friend and fellow VP and CIO at St. Luke's Health System. So Reid, the mic is yours for a round of introductions with our fellow panelists.
Awesome. Thanks, Liat. St. Luke's in Boise, Idaho. Sometimes it's easy to confuse with the Missouri or Pennsylvania or any number of St. Luke's across the country. But I'm thrilled today to have with me two friends, Heather Monnake, who is the Executive Director of Patient Access and Engagement at WakeMed in North Carolina. Heather, welcome. And Chuck Podesta, who is the CIO at Renown Health in Reno, Nevada. Chuck, I may call you Wyatt Earp by just like muscle memory, but if I do, just know that that's who I'm referring to on this conversation. So Thank you both for making the time, and this is going to be fun. You're both very pragmatic and candid with your comments, and I think our attendees will learn a lot from this conversation. But let's start with, we use the word digital front door, we use the word transformation so frequently that it maybe loses meaning, or people assume a meaning that may not match our meaning. So just for the purpose of our conversation, I want to start there. Heather, I'll start with you. How do you want to define the concept of digital front door for this conversation today?
That's a great question, Reid. So I guess for me, digital front door is, I truly believe that people should be able to do anything digitally that they would be able to do if they were interacting with us in person. So to me, that digital front door is meeting patients where they are and really mirroring those, tried and true workflows that we have put into place, for scheduling or communication, any kind of communication, test results, messaging, all of those different things. But transitioning all of those human touches to having patients have that same experience, but from a digital standpoint, and feel more cared for in that way than they would have had they had to have made a phone call and left a voicemail and had us call them back, if that makes sense.
It does. If we don't meet a patient where they are digitally, then we're really unlikely to meet them where they are physically. And so I think that your overview kind of highlights that. Chuck, I'm going to give you the word transformation. Sometimes that word, it's a buzzword. People then take it to mean it's got to be this moonshot type of huge activity. Maybe just take a minute to give us a more pragmatic way to think about transformation.
Sure. Yeah, thanks. And so from my standpoint, it's really about for me, it's sticking to the knitting. And that's a program that I call, when I ever go to a new organization, I always, depending on the type of organization, the transformation, it can't be overnight. We're just not built, for overnight transformation in healthcare. And I'll just give you the example when I got here at Renown 3 years ago. Usually as a CIO or an IT leader, you go into a new organization, there's some things you got to fix, one or two things that you got to fix. First time in my career, and I've been CIO for 30 years, so when I came here, I had to fix everything. And it was just
a major transformation.
Yeah, that was a transformation because it was culture, it was employee engagement. We had a culture of no, we had morale, we were spending too much money, and just didn't have kind of the respect of the customers, and no governance. They were going around the IT organization. So it was really that to me was the transformation, the foundation that needed to take place before we could do anything like a digital front door or any of those things. Would have failed miserably without that kind of transformation first.
It's such an important point. We want to maybe jump right to the technology components of the transformation, but if you don't have the culture, the processes, the governance, if you don't spend the time with that work, you are going to have a really sandy foundation that your technology transformation, no matter how slick it might appear, it's just not going to be sustainable.
Right. And without a solid team in place, the transformation is going to happen, and we're probably going to talk about this at some point, how fast it's going to go from this point forward with AI and some of these other technologies. And I'm sure Heather's working on this within her digital front door and utilizing technology. If you don't have that base foundation in your organization, solid governance, good culture, good teams in IT, success in implementations, you're dead. You're dead in the water. You won't be able to do any of this stuff and be successful at it.
Heather, let's talk just a little bit about, and this is like, I know at WakeMed, when you have transformation initiatives, they are warmly embraced. They just go flawlessly, but let's just assume that maybe is not always the case. And there can be resistance internally to this change, this fear of disruption. Maybe just kind of share with us, if you would like, an example of where you've kind of felt that resistance at WakeMed, and then ways that you found to help navigate, not around, but like to get everyone on the same page and like manage through that resistance.
So I think I should start by saying my panelist counterparts here are both in IT. I am actually in operations. So that is a differentiation between some of the information that you're probably going to hear from me from my perspective. And I was, my job was created, I think, at the behest of IT, because y'all were our IT department was having such trouble sort of breaking into that people and process piece of it to be able to create that sort of groundswell of adoption. I will say that it's impossible to think of a single change or transformation that we have undertaken in this system. And I have worked here for 20 years that did not come up with some kind of resistance. I would say that it's absolutely impossible to think of a single change that we didn't encounter something. Change, honestly, is very scary for people, and there's a whole lot of misunderstanding. So the way that we typically try to navigate through resistance is to try to address that fear up front and be able to provide some clarity for folks, to be able to help them understand why we need to make the change, how the change is going to really impact them, and how we're asking them to balance all of those competing priorities, because that also is a big reason for resistance. Well, we just don't have time to implement this thing, whatever it is, even if it's going to be amazing and awesome at the end of the day. There are a lot of barriers in the way to being able to find success there. I also think it's really funny because the biggest resistance that I hear over and over again, whether or not it's a big change or a small change, is that I'm special, but everybody can't be special. Like, if you are all special, then that literally means that nobody is special. So I think at the end of the day, we have to start with the why. We have to provide the education to folks to help them understand what we're trying to do, why we're trying to do it, and how they're going to be impacted by it, and provide them with that clarity of how they are going to be involved in the change overall. And then I think also really focusing on the standardization, and Chuck, you mentioned governance. Governance is absolutely critical and is one of the hardest things that we do, very honestly, because it is hard to get a governance structure and then maintain that governance structure over time. I think you have to have a lot of leadership support to be able to do that. And I also believe strongly in really kind of locking things down. Once you have overcome some of that resistance, you've gotten the change, sort of people agreeing on that change. Then with that governance, locking things down so people can't go back to the way things were. I mean, I'll use COVID as an example. We made so much change over COVID, but a lot of the things that we did over COVID, we've sort of reverted back. So we got to figure out a way, once we overcome that resistance and find the whatever the reason is that we change, whether there's dissatisfaction, there's pain, something is being is obsolete and no longer supported, whatever the reason for the change, when it happens, we need to make sure that once we figured out how to overcome that resistance, we need to hardwire it. I think that's kind of where those are sort of the reasons that, when we are talking about resistance and overcoming resistance and what we need to do to be able to deal with that resistance.
Yeah, you know, first of all, as you kind of identified your role being different than the CIO, if there's any kind of hierarchy, it's Heather, like you're here, and then, you know, me and Chuck are down here. So we're so grateful for your operational perspective. You just said something that was a nugget for me that I'd never really kind of articulated in my own mind, but that is the fact that you're going to face resistance. And you said that, like, I can't think of a single initiative where we didn't face resistance. And I think that's a good mindset to have going into whatever you're attempting to do, and to not be scared of it. Resistance does not mean it's not, you know, right versus wrong. It doesn't mean that it's a bad idea. It doesn't mean that you are kind of pre-subscribed to failure. I think it's just a natural human element that we need to know is going to be there, and then not panic when it does kind of emerge. And then all the things you describe, have a strategy or an approach for how you're going to manage that. And sometimes, speaking from my own experience, we get resistance, in particular if it's a clinician or someone of high standing in the organization. And we then sometimes panic and retreat instead of like leaning into the moment. So thank you for that insight.
Yeah. Well, and I think the leadership support is absolutely critical too.
Mhm.
You have to have that at the top. They've got to be willing to stand behind
Yeah.
the decisions that we make. So
Yeah.
yeah, and we have a lot of outside pressures. Even, I mean, we're a large organization. We were established in 1961, so we've been doing this for quite some time. And there's a lot of, we've done it this way for a long time, and it's worked.
Yeah.
So I think, you know, it's hard to pivot that. And then even outside of the internal resistance that we get, there's a lot of external factors too. I mean, you think about insurance companies and other things like that that make sometimes the resistance more difficult to manage. It's
Yeah.
almost easier to deal with the internal change than it is things that you're not able to control.
Yeah, great point. Well, let's shift gears for a minute here. You know, if a digital front door is built on governance and processes and a team and technology, it's empathy and vulnerability that I think keep it open. And so the title of this session is Tales from the Trenches. And so Chuck, I'll start with you. Would love for you to share, you know, as much detail as you would care to. What's an initiative that you've been involved in that maybe failure is not the right word, but it just didn't have the success that you imagined? What did you learn from it, and what lessons might you offer to our listeners?
Actually, there's been, in my career, there's been lots of them.
Me too.
And yeah, and which is actually not a bad thing. I mean, at the moment they are, but it's the learning from that, right? That you get. So when you get to be my age, now you have wisdom, right? Because you've made all those mistakes, you know, along the way. And I think most of them are project related. If you think about it, I'll just think about it holistically, because I think that's where we run into issues in IT. And get back to your earlier comments, you know, business, these initiatives need to be business led, not IT led. And there's less resistance when it's business led. And then when there is resistance, you've got a whole team around it as opposed to just an IT led initiative. And I think back in the day, when I was a younger exec, a lot of these initiatives were IT led. So, you know, when you created a project, you got it approved. Now you went out there and ran into a brick wall to try to get it actually done. And there were definitely failures along the way. And what I realized was that, you know, projects are made up of three things, right? It's the scope of the project, it's the resources, which includes people and dollars, and it's the timeline. And those three legs of the stool make up a project. And a lot of times, you know, you go into these projects, maybe you have a really solid scope, you're pretty sure on resources, but maybe not. And timeline, you're pulling that out of the air. What I found, and I learned the hard way, is projects fail at the beginning, not at the end. And I will not ever again, because of some of these failures and mistakes, start a project unless the scope is like completely well defined, the resources are well defined, both dollars and people, and that the timeline is a realistic and solid timeline. And you don't start the project. You can call it phase 0, whatever you want to do when you're planning it. It might take 6 months, might even take 8 months for like an ERP project or something like that. But I see so many mistakes are made where people, they get approval to do a project, and then it's like, okay, let's go,
Launch.
let's put a team together and let's move forward. And you don't have those three legs of the stool well defined, or you have partially, and you don't have them well defined, but you move forward anyway, because you're thinking you're going to fix it along the way, right? And that's not realistic either. And so again, I learned, and one thing, if you get out of this, any IT leaders out there, projects fail at the beginning, not at the end.
Well said. And I've seen sometimes people will leverage agile or sprints as kind of like air cover to not do that due diligence planning up front. I've experienced exactly what you described. Heather, how about you? What's a tale from the trench and a lesson that you would want to share?
So actually, I just want to comment real quick.
Yeah.
Chuck, I agree 100,000% that the planning piece of it is the part where we probably don't spend nearly enough time, because as I mentioned earlier, where we run into the most resistance is because of that lack of clarity. And if we spend the time planning and getting things on paper and sharing that information with people, then they will understand the project and understand their role in it and understand why we need to do this and help us, and maybe not provide so much resistance when we're trying to implement it. However, I did also mention that I was on the operations side. So I do not think of projects the same way that you guys think of projects, because to me, it's not like there's a start and a finish, because we are on a journey 100%. So I don't have specific example of a project that's sort of like something that crashed and burned, because I always think of it like, I actually have a picture of Dory on my door right now, because I recently watched the movie Finding Dory. And it's not about Dory's short-term memory loss. It's about the fact that Dory always finds a way. And so for every single thing that we do, just like Agile, we have to constantly be looking at it and saying, okay, we didn't fail in the tech piece of it because we implemented the technology, we turned it on, but that's not what our level of success is, right? That's not what we're measuring. We're measuring whether people are using it, whether it is working, whether people are happy with it. So I feel like that failure, it's never, in my world, failure is not like a big bang. Failure is more just sort of like a soft fizzle where people just stop doing the process or using whatever technology it is that you put into place. So I feel like the issues typically are the people in the process as opposed to the tech. And I also think that we really need to work really hard on managing those expectations up front through the planning phases, to make sure that people understand what they should be expecting, as we move through whatever project it is that we are working on. I will give you an example. We are all working really hard to develop and implement online scheduling. So we are I'm going to say we're relatively far ahead in the number of specialties that we have turned on for online scheduling. And we've done that in a number of different ways. However, we sort of have systematically people working against us having real successful online scheduling, because there's ways to not offer certain visits or turn this off or remove that visit type or all these things that we don't necessarily have a way to track. And the reason they're turning it off is legitimate. It's because it's not working for them. The wrong patients are getting in the wrong spots with the wrong providers. So we are actually undergoing a really large project right now, call it a project, on our journey to be able to make it so we can have safer scheduling. So again, we didn't fail, but we did have to kind of use Dory's agile process to be able to go back and say, okay, what do we need to do now to make it so this is working better for all of our customers, both our physicians and our patients?
So let's explore that for a little bit, Heather. That's a great point. Let's talk about, in the context of change management, engagement from clinicians, and to make sure that it's not just viewed as a digital experience for the patient, but it's a clinical tool that can enhance workflows, improve care delivery, even reflect the expertise of the clinician more fully. What are ways then, so if you think about your online scheduling, and this question is to both of you in whatever context you want to respond to it, how do you keep clinicians and other stakeholders engaged? and really cast it as a broad experience you're trying to design, not just something for patients?
Well, I mean, here, in our digital front door journey, we just went live with our phase 1 in July, and we're working on our phase 2 right now. And as Heather said, collecting the data to see kind of where it's working, where it's not working, and making adjustments as we go. But when you think about, we talked about resistance a little earlier, when you start a digital front door project, you most likely, one of the resistance areas could be the physicians, right? Because you're going from them controlling their schedules to you're opening up their schedules for patients to go into their schedules and make their own appointments, right? And that's depending on the type of that could be difficult for them to wrap their heads around. So that engagement early on with them is really important. And you have to kind of go slow. We went slow with kind of opening, doing one area at a time. And then what happens is people, and you start with some volunteers basically that want to work with you in a pilot mode. And then they see that, okay, this is actually good. It's better. One, the patients that are showing up on my no-show rates are going down, things like that. And then the word gets out, and all of a sudden these other areas, and that's happened to us. We did primary care physicians, and then all of a sudden, women and children's came forward and said, hey, we want to get on this online scheduling thing. And then the specialties came forward. Hey, we hear that's working really well. So it's kind of an incremental as opposed to trying to get everybody on board at the same time. And I think all the organizations I've been into with working with physicians, is that's an area where you're really going to have to focus on early on. Some of it too is you got to look at how they're paid, because you could be in a situation where you're adding patients to their daily schedule, and depending on what they're incented, right? Is it productivity incentive, or is it a revenue incentive? What is it? And it could be a different resistance based on that, which is totally out of your control, right? As an IT or as Heather, but you got to be aware of these things that, as you go into it. Yeah.
Heather, I saw you making a note. Do you have something you want to comment on?
Yeah. So Chuck, you said payment. So you're talking their language. They want new patients. They get paid more for new patients. Exactly. Online scheduling, whether it works amazingly well or it doesn't work, it is a wonderful patient acquisition tool. So whether or not those patients are getting in the right slot with the right provider at the right time, they are new patients. And that is one of the things that physicians want a lot, because they do get paid more for it. Chuck, do you have anything else you want to say, or am I allowed to jump in?
Go for it.
Jump in.
Okay. So first of all, I would like to say that the doctors think that they have control over their schedules, but they don't actually have any control over their schedules at all. And it's really kind of sad. And I feel like that we need to give them back some of that power. And that is the one thing that I have actually learned going through this process. And the way that physicians, at least in our organization, see their schedule, and the thing that they care about is what the office flow really is, right? So they think that they want a new patient here and a return patient here and a new patient there, and they think they're controlling it in that way. But when you really go look to see what is happening in these really busy clinics, that is not what's happening at all. Patients are everywhere, all the time, all different kinds of patients. So they feel like that they are powerless. They think they are empowered because they are physicians, but at the end of the day, from a scheduling perspective, they are actually powerless. So they have for years been, I would say, kind of done unto. So one of the things that I specifically have been really focusing on a lot over the last year is meeting with each of our physicians, especially our physician leaders, and saying, what do you want and how can I make it happen for you? Because if we can do that, then we're going to make it so we get the right patients in the right slot at the right time. But I have to understand their workflow. I have to understand the things that they are dealing with on a daily basis. I have to understand what frustrates them so I can prevent that from happening. And then I need to help them get more of what they want, which is those new patients and things like that. I also think that incentivizing them in other ways. We have system level goals for some of our patient access metrics to be able to support some of the tech like online scheduling and self-registration and things along those lines. And that has it's taken some time, but we have had sort of a trickle down effect of those goals. So now they're actually included in our physician compensation plans as well. So they are compensated based off of the percentage of appointments that they make available online. So that's also helped us a whole lot. And I would also say that the open line of communication with physicians and managing their expectations is absolutely critical, because we will never get 100% accuracy, but we can get a whole lot better than where we are now.
Mm-hmm.
And then I think after that, if you make the doctors happy, then you're going to make the schedulers and the nurses and everybody else supporting them happy too. Great
advice. As we're getting towards the end here, let's talk about sustainability for a minute. So it strikes me that the real question isn't, are the patients going to use your digital tool, but are they going to want to use them again? Are they going to come back? Have you created kind of that flywheel experience? And so, question for both of you, whoever wants to chime in first, what are the metrics or indicators that you have keyed in on to help kind of measure the long-term success of your initiatives that let you then make those kind of in-flight adjustments or pivots to improve the experience?
Go ahead, Heather. You're the expert in that area.
Oh, well, I am. Thank you very much. No, I'm kidding. We actually have spent a tremendous amount of time building patient access dashboard to be able to see all the different access metrics that are meaningful to both the organization as well as our clinicians. So, we measure things like lead time, and we measure things not only for new patients, but return patients. But we actually have a little bit of a different problem now, because when I first started this particular job 5 years ago, and we did not have any access data, honestly. So that was really the first thing that I worked on, was building a dashboard. Our EMR also has some pretty good stats for us too, but we actually have an opposite problem now, is that we have too much data. So we have to be very disciplined in which data it is that we look at and what data we care about. We can answer almost any question with data at this point. However, like I said, I think that at this point we are sort of needing to be disciplined about what we're paying attention to. Call metrics, online scheduling, self-registration, like I said, lead time, cancellation reasons, reschedules, like all of that. And I kind of just get down to let the data lead you to where you can make the biggest impact. But at the end of the day, if you just do the right thing, then your data is going to move, and it's going to move in the right direction.
Yeah, I totally agree. We're in the same, we're inundated with data. We've got all these different systems out there that are collecting this information, the call systems, the CRM systems and everything. And we're still in the early phases of figuring out what matters, exactly what Heather's talking about. I think where we're trying to go with it, though, is to really create a personal persona, so that we understand each and every one of those, especially the new patients, and how they want to be treated, so that we can give them kind of the Amazon experience, right? And that takes a lot of data, but it takes a lot of analysis of that data as well to get to that point. We're certainly not there yet. We want to get there so that we know when there's a repeat patient, we know who they are, we know what their preferences are, we know how they want to be contacted, we know a lot about them, and give them that kind of Amazon experience going forward. That's our ultimate goal, but we're certainly not there either.
So we've got time for, I think, another question, and I want to build on something that was said earlier. I think, Heather, you mentioned this truth that you need to have buy-in at the executive level, but then even across the organization, success from your transformational efforts are going to come when everyone from executives down to frontline staff are embracing technology as a catalyst to drive better care, not as a tool. And as we've talked today, like listeners will know, like we've spent very little time talking about specific technology, because that's not that it's easy, but it's easier when you do the hard work up front. So I'd love to have both of you comment on how you found success in trying to create that synthesis of embracing that mindset, that it's not just a tool, but from the executive team down to the frontline staff, we have to embrace this as a catalyst to drive better care. What are ways that you found to have that conversation?
Go ahead, Heather.
I was trying to think of what a good answer to that question would be, Reid, because I mean, I still, like I mentioned before, I still think we're really on the journey, as is, I'm sure everybody who is on this webinar right now is on this journey too. So that's a very difficult question to
And there's
answer.
probably not a destination, right? There's never a
Yeah, it's not.
mission
I mean,
accomplished
I feel
moment.
like you've made it when it just becomes the thing you do.
Right.
And you don't think about it, right? So like our patient portal, for example, we had to spend a lot of years trying to get adoption of the patient portal. Now it's just the thing that we do. Like it's not, there's no lift in that.
Mhm.
I don't
But
know.
it wasn't just like one thing though, right? Like it's this kind of layered, like every interaction, no matter how insignificant it might seem, where you explain the why, get buy-in, like there's a cumulative synergistic effect from that
Mhm.
leads to where you're at today, where it's just kind of a foregone conclusion. But there's probably
So,
months and years, that journey you just described.
years.
Yeah.
And I think that I'm going to use the word trust because I feel like trust is a really huge component to that too. I think in the beginning it was, especially with, let's just use the patient portal as an example, because that's one I feel like we've gotten really far with. And I'm sure lots of other people on this webinar have lived this same journey. But people didn't necessarily trust it. They didn't necessarily think there was anything in it for them. They didn't understand the way that it worked. It was a little bit scary for them, all of those things. So I feel like that if just that trust is a really big piece of it. The product has to work, and if it works and it fits in your life, whoever you are, whether you're the patient or the clinician or the senior executive leader, then you will find success there. I mean,
Mhm.
I don't know, the leaders in our organization are wonderful people, but they are not, other than our CIO is not, super tech savvy. So they are also just patients. So I hear all the time, why didn't this appointment show up when I thought it was supposed to? Why can't I schedule with that person? And boy, I tell you what, I'm sure y'all live this too, but when they have a bad experience or something doesn't work the way they think it should, they hold on to it. And you hear about it for 2 years, the same example.
Yeah.
So I think that it really is
ways.
about trust. It has to work.
Yeah, and exactly right. And you mentioned it earlier, Heather, when you went out and talked to the physician staff what they want, and you're able to deliver on what they want because the technology's there now.
Mhm.
If you think about where we were years ago when we were implementing electronic health records, and you were meeting with physicians around that, it was hard. That was hard to get buy-in. They viewed it as a billing system, a data entry system. There was they could not see the benefits to themselves on that. But the technology we're employing today, they can see that. I'm using them as examples, but nurses as well. You look at, I know, Reid, you're doing some of the ambient listening technology in the ambulatory care areas like we are, and content building for the physician when they're seeing a patient. It's a huge satisfy. I had a physician that said, in a pilot, if we don't deploy this and you take this away from me, I'm quitting. And I remember doing electronic health records. It's like, if you make me use this, I'm quitting. So it's like a completely change. And then, when you talk about the future with AI, and assuming we don't mess that up and when we do it the right way, finally have technology that actually helping people do their jobs. And as long as we're smart about deploying it, we'll be successful.
Well, let's, based on time, let's leave it right there. We could go on for a lot longer with both of you. Heather, Chuck, thank you. Thank you for your expertise. Thank you for your candor. I would just add like a tagline summary to this conversation based on what we were just talking about, which is trust. And trust is really the currency that's going to drive these effective digital transformation initiatives. And without that, you're going to struggle.
Yeah.
Thank you
Agreed.
both. Liat, back to you.
Thank you all for this very insightful session. Thank you so much for joining us. I did get some private questions in the Q&A, so I'll send those over to you just for sake of time via email. So Heather, Chuck, and Reid, you'll be able to answer those afterwards, and we'll get back to our attendees. Thank you again for making the Digital Front Door better, and we can't wait to have you back next year, hopefully, as alumni speakers. And thanks for our attendees for joining us. See you at the next session, which is actually our closing keynote, future-proofing your digital front door strategies for 2025 and beyond. Hopefully you three can maybe join us there, leaving attendees off with food for thought for the future. So thank you so much, Reid, for leading this discussion, and see you guys soon.
Yeah. Thanks a lot.
care.
Appreciate it.
Thank you.
Bye now.